Hi, this is Pete Fernbaugh. Welcome to Trinity Talk. Today's guest is Dr. Suresh Srinivasan, pain management specialist here at Trinity Health System. And Dr. S, we could talk about so many different topics, but today I want to start with when does someone know that it's time to see a pain management specialist?
So anytime someone has a pain which is not responded by their treating provider for more than 2 weeks, they always think about seeing someone more specialized in pain management.
Interesting. Does the average person have that feel, or do people come to you? Do they know when they should see you, or do people come to you too late normally?
Most of the times they will be referred by their treating provider, either their primary care doctor or their orthopedic surgeon or their surgeon, whoever does any surgeries, or it could be from any other medical provider. They think this patient needs to be treated or seen by pain doctor, they will refer to me.
So take those referrals seriously.
Yes.
Yes, absolutely. The second thing, what are some non-medicine things we can do to relieve pain?
So there are a lot of things that we could offer for patients who suffer from chronic pain, and all those procedures that we offer are minimally invasive. Almost there is no downtime. They can return to their normal activities as soon the next day, and also they do not have to be do any rehab after those procedures. It can vary from small injection to minimally invasive device implantation.
How should someone prepare for their first office visit with a pain specialist?
So always prepare for some questions like where is the pain, majority of them, and how long ago it was started, and go through all these mental checklists and have a pain diary if you have, showing like what are the activities makes your pain worse, and also like try to gather previous treatments, what have been done before, have you had any injections before, or any imaging studies done like an MRIs or X-rays, if there is any discs available, and also most importantly bring the current medication list that you are taking. I think that should be enough.
So it's important for folks, I think, to understand that they are the experts on their own body. So it's important to prepare, as you're saying, ask yourself those questions. How long have I been having this pain? Where is the pain hurting the most? Everything you just listed. So it's important to state that preparation to see you,
Yes.
Mental preparation, we can't emphasize that enough. You mentioned pain diary. Is that the best way to keep track of just writing it down, keeping track of time, how long between occurrences of pain? Anything else they should be tracking in that diary?
Also mostly like what activity makes your pain really worse. Like, some people say like, I hurt when I am just sitting for same place for 20 minutes, or like anything specific than others, like don't just say everything hurts.
Right.
Better, give me some more informational, like, I'm trying to get out of the car, I hurt on my left hip, or like anything more specific to your pain will help me find better diagnosis.
So where it's hurting, when it's hurting, what causes it to hurt, how much it's hurting, all of those are important questions to ask.
Yeah, everything, including is it hurts more in the morning, is it hurts more at the end of the day, all those little details.
And the more specific they can be on that first visit with you, the more you can do for them.
It's easier to have all the information available for the first visit.
Excellent. The next question I'd like to ask you is, how do I know, the layperson, the patient, how do I know if a medical intervention is needed for back pain?
So as long as the pain is there, and even your senior primary doctor or like whoever your treating doctor, it's not getting better, then you should think about, okay, like the pain is not going away, or I tried over-the-counter medication, I take it easy for 2 weeks, still I have a pain, then it's the time to see someone.
Yeah, and it's that level of personal responsibility that's necessary to make it, to help you do your job.
Exactly, and also like a lot of people take it light too long, and then the pain linger around, and the longer the pain stays in your body, it's harder to get it out of the system. It's kind of like gives you the pain memory. So that's it's well proven, and it's harder to treat if you suffer pain longer duration.
So if the longer you wait, not only does the physical impact increase, but the psychological impact.
Absolutely.
And at some point, do the two become hard to separate for patients? Both are interacting there. They have that pain memory, but also that pain reality.
You're right. And pain is multidimensional. It's not just a physical problem, and also it has like a different other aspects of the problem, like a social problem, economical problem, and also the psychological problem, besides the biological pain problem.
It's amazing how much pain can cover, how many aspects of our lives. And you mentioned socioeconomic, just the ability to do your job. And it's interesting how it all interacts and affects all areas of your life.
Yes. And pain is most common reason for people to go to the doctor or any healthcare provider. So out of 90% of the people, they go to the doctor for some type of pain. Mm-hmm. So it's not ignored.
Yeah, that's a good point. So I'm going to move on to some other questions, if that's okay. What are the most common body parts that cause pain?
So most common patients I see, they come with either lower back pain or the neck pain, and those are all mostly secondary to different degenerative reasons. May have worn disc or bulging disc, kind of like a disc-related problem can give like a neck or back pain. And also common other part I see is sciatic pain, like pain going down the legs, pain going down the arms, and also is rarely time to time I see patients with abdominal pain or pelvic pain or even with headaches.
Excellent. Okay, my next question for you. What kind of training do you have to have in pain diagnosis and management?
It's a fellowship program we do after our residency program. It's a 1-year training. We do a variety of patients with different pain diagnosis, and also in a monitor setting, we will be doing different procedures, and that will be helpful for us to go and practice in the real world.
Very good. How should one define chronic pain? It's one of those terms we think we know what it means, but what is it actually? And once we've identified chronic pain, how do I know that I should see a pain management physician?
So any pain that's not getting better after 3 months of the initial injury is considered chronic pain.
Okay, 3 months.
3 months.
Okay.
After initial injury or initial surgery or not healing well.
Mm-hmm. And that's when you should go see someone like yourself, a pain management specialist.
Yes, that's recommended to see a pain management physician if your pain not getting better after 3 months of treatment.
Or talk to your primary about getting referral to one.
Yes.
And what are some treatment options? I'm someone who doesn't like to go on medication, so what are some, unless I absolutely have to, what are some treatment options that are available besides medication?
There are a variety of interventional procedures available nowadays for treating chronic pain, and it can be simple injection, or it can be minimally invasive spinal implants, or it can be some other treatments like physical therapy or chiropractic care or acupuncture. There are different options besides the medication available to treat chronic pain.
And should folks explore those options even if they are on medication?
It's better because we wanted to give as less as medication possible. Mm-hmm. So we always encourage to have a multimodal approach, which means they can have injections, also some kind of medication, and then physical therapy.
Okay, very good. So what are some common chronic pain conditions that you treat?
So I treat variety of pain diagnoses, mainly from degenerative conditions. 80% of my patient populations are like older than 75, 80. So a lot of them are degenerative, means it's a natural progression of arthritis in varying parts of the body. And the main problem I see is a lot of arthritis in the back and a lot of disc-related problems I will see. And also I see patients with previous surgeries. Either they had previous back surgery with persistent pain, or they had previous shoulder or knee surgery with persistent pain. And also I see some patients who cannot have any surgical procedures because of their medical comorbidities. So they come to see me to manage their pain.
What are some of the chronic pain conditions that younger people see you for?
So the younger people, sometimes they have injury and that's kind of like creates more and more nerve-related pain. And one of them is RSD, we call that as a complex regional pain syndrome. That can happen to the younger people. And also slip disc, if someone trying to lift something or fall from somewhere, they can slip the disc and they can have sciatic pain or back pain. Those can happen to the younger people, I see very often. And also sometimes I see sports injuries, people torn meniscus or repair like any ligament injury in their shoulder. Those are all the patients I see.
What are some of the minimally invasive pain management interventions that you are able to conduct?
We offer a whole variety of interventional procedures. Some of them I want to talk about. Recent years, it's gaining a lot of popularity is spinal cord stimulation, which is we are using electric impulses to block the pain signals in the spinal cord, and which is almost like a pacemaker to make your heart beating. So this is kind of like using electric signals to block pain. So that can be done for back and leg pain or neck and arm pain. And even now, also we offer individual peripheral nerve stimulation, which is targeting single peripheral nerve to conduct pain. So for instance, if you have pain in the shoulder, so I place this electrode wire in the shoulder to block the shoulder pain. Or if you have a knee pain, which is not going away even after surgery, I'll place an electrode in the knee to block the pain. So like that, we will choose wherever the nerve conducting the pain, we can block that.
That's remarkable technology. Is that relatively new or?
Initially, the spinal cord stimulation came like almost 50 years ago, but last 10 years, it's grown up a lot. And now we understand more and more, so we can offer more advanced treatment.
So folks shouldn't be afraid to come and see you. You've got a lot that you can offer them that will help relieve that chronic pain.
Exactly. We now better than ever, and we are able to give different procedures to the patients to block the pain without taking more and more pain medication.
My final question for you. What is nerve stimulation and how will that help chronic pain?
So we just talked about it. Yeah. It's like a two type of nerve stimulation we offer. One is a spinal cord stimulation, which is kind of placing a wire in the back to block the pain in the back and the legs. And the other type of stimulation is a peripheral nerve stimulation. We all know the nerve conducts the information where you're hurting to the brain. So we are using this electrode wires to use the electric signals to block the pain.
Excellent. Well, is there anything else that you would like to communicate to the public? Anything that you'd like to emphasize as a specialist?
I would recommend, if you have long-lasting pain more than 3 months, talk to your primary care doctor to get evaluated by the pain specialist. And also recommend not wait too long or self-medicate yourself or take family members' medications or something like that. So seek for medical attention.
And track that pain. Keep that dot
track
rate.
that pain and see earlier than later.
Excellent. Dr. S., thank you so much for being with us on Trinity Talk. And thank you so much for tuning in. We hope you'll join us next time.